Hello friends, in this video we will be discussing with the most important one-liners from the surgery. These are basically the previous year's asked question formed in the form of one-liners so that you can get all the questions in a very less time and you get to know the important ones. Treatment of choice for desmoid tumor among four options. The answer is wide excision. Escape lesions are seen in Crohn's disease. Hirschsprung's disease is due to failure of migration of neural crest cell from cranial to caudal direction. Allopurinol used in organ preservation as it is a free radical scavenger. Not a predisposing factor for esophagus is mediastinal fibrosis. Being among the four options, if you find mediastinal fibrosis, it is not a predisposing factor for esophagus. Following is used to define neck penetrating injury. Means if any injury reaches the platysma, it is defined as neck penetrating injury. Most common cause of esophagitis is esophageal reflux. Nicaldoni sign is also known as Branham's sign. Central dot sign seen in Caroli's disease. Most common site of cholangiocarcinoma is hilum. Bariatric surgery procedure includes ileal transposition. Most common site of peripheral aneurysm is popliteal artery. Important. Ipsilateral supraclavicular lymph node, that is N3C, are positioned in a patient of CA breast stage is stage 3. Means if you find ipsilateral supraclavicular lymph nodes positive, then you will stage the breast CA as stage C. Stage 3. Glomus tumor most seen in finger. In cornate classification, segment 4 of liver is quadrate lobe. Shoulder pain post-laparotomy is due to CO2 retention. In which of the following head neck cancer lymph node metastasis is least common? So it is the hard palate. See, these are very important one-liners. You just listen to them and you will make it correct in your exam. Most common site of curling ulcer is duodenum. Most common site of peripheral aneurysm is popliteal artery. Earliest postoperative complication of ileostomy is necrosis. Ideal age of orchidopexy is 6 months. Colonic diverticulosis is best diagnosed by barium enema. Severity of acute pancreatitis correlate with level of all of the following: glucose and calcium. Least risk of CA breast is seen in ataxia telangiectasia. Hypotension in spinal injury acute is due to loss of sympathetic tone. Earliest post-operative complication of ileostomy, again very important, is necrosis. 1.5% of glycerin is used as an irrigation solution during transurethral resection of prostate. Renault pentad is characteristic of cholangitis. Bilateral renal carcinoma is seen in von Hippel-Lindau syndrome. Fever, jaundice, right ureteric pain, septic shock, mental status is Renault pentad. Pre-pyloric or channel ulcer in the stomach is termed as type 3. An emergent viral pathogen causing pyelonephritis in kidney allograft is polyomavirus. In a 6-year-old child with burns involving whole of the head, neck, estimated body surface area is 52. Means you must know how to calculate in children the burn part of area. Helmich valve is used for the drainage of pneumothorax. Important. Helmich valve for pneumothorax. Acute and recurrent pancreatitis is reported to occur in methylmalonic acidemia. Transverse fold of rectum is not a permanent mucosal fold. Most common site of subclavian artery obstruction is first part organ most commonly damaged in bomb explosion is eardrum. Drug used for detrusor inability are solifenacine, flavoxate, tiapretide. Intermittent claudication means pain in leg only on exercise. Latest classification of Williams tumor is AGCC tumor classification. A person was brought through the emergency room after his dinner with the chief complaint something is sticking in his throat, which later progressed to dyspnea, and diagnosis is most commonly it will be foreign body going into the larynx or the airway. A nodule of 2 cm in the left thyroid diagnosed as papillary CA thyroid. Treatment of choice nowadays, we do total thyroidectomy. We do not do hemi or all other for the papillary CA thyroid of 2 or greater than 2 cm. Trust should not be advised as a treatment of choice of femoral hernia. Richard's hernia, very important, is most commonly seen in femoral hernia. Hydrocele is a type of exudation cyst. Important. Appendicular stump is obtained by ligation and inversion. In a patient with cirrhosis of liver, the site of obstruction in portal system is in sinusoids. Most characteristic of congenital hypertrophic pyloric stenosis is that it affects the firstborn male child. Means in the question it will be given most commonly that it is the firstborn male child. Poorest prognosis in lung cancer is associated with small cell CA. Popcorn calcification in lung nodule is seen in hematomas. Very important common one also. Barrett esophagus causes true adenocarcinoma of esophagus. Taxol is not used nowadays in breast cancer. Medullary CA thyroid is most aggressive in type. Men 2B is medullary CA is most aggressive. Odontomas, which is locally invasive malignant tumor, is amyloblastoma, locally invasive malignant tumor. Most common neurological abnormality that occurs with head injury is altered consciousness. Isograft is between monozygotic twins. Pseudo claudication is due to compression of popliteal artery. Visceral aneurysm is most common in splenic artery. Mixed parotid tumor are firm and capsulated. Raynaud phenomena is associated with vaginous granulomatosis. Bejeweled abscess is present in sternocleidomastoid. Vincent angina is caused by Borrelia vincenti or fusiformis. In neck dissection surgery, the structure saved is phrenic nerve. NMYC gene is seen in neuroblastoma. Bleeding tendency in case of esophageal varices depend on size and site of varices. A string of bird sign in arteriogram is diagnosis for fibromuscular dysplasia. The most common cyst of jaw is radicular cyst. Brunner's gland is stimulated by acetylcholine. Strangulation without obstruction is seen in Richard's hernia. Commonest pancreatic tumor is insulinoma. Carcinoma tongue is predisposed by irritation, syphilis, sepsis, pulpitis. Commonest site of thyroglossal cyst is suprahyoid, and we do cyst trunk operation for the removal of thyroglossal cyst. Splenectomy is the best treatment for hereditary spherocytosis. Massive splenomegaly is seen in hair cell leukemia. Hunterian ligature is for aneurysm. In a villus papilloma of rectum which is lost, potassium is lost. The commonest pancreatic tumor is insuloma. Most common infection post-splenectomy period is of pneumococcal. That's why we give pneumococcal vaccine before the splenectomy operation. Sagospleen seen in amyloidosis. Meralgia paresthetica involves lateral cutaneous nerve of thigh. The commonest site of cialis is submandibular gland. Double bubble sign is duodenal atresia. Most important sign in acute appendicitis, pain in right lower abdomen. Most common primary source of mets to brain, lung. Cannonball in lung is renal cell carcinoma mets. Hounsfield-Romberg sign is seen in obturator. Mm, Obturator, this I need to check. A herniation of abdominal content through right side of the abdominal wall is gastrochosis. A foreign body usually gets arrested in which parts of esophagus, that is above the cricopharynx. Serum acid phosphatase is increased in Paget's disease. The commonest complication of pseudopancreatic cyst is infection. Subfacial ligation of perforators. Stripping of large saphenous vein is used in patients of venous ulcer with edema and tenderness. So this completes around 90 one-liners. I will be coming with the further one-liners in the further videos. So till then, stay updated, stay focused. Thank you.